Metagenomic next-generation sequencing for infectious disease diagnosis, clinical applications and management. Metagenomic next-generation sequencing, mNGS, now detects bacterial, viral, fungal, and parasitic DNA/RNA with a pooled sensitivity of 85% and specificity of 95% across diverse infections, reshaping epidemiologic surveillance. By unbiasedly interrogating all nucleic acids in a clinical specimen, mNGS bypasses culture limitations and reveals antimicrobial resistance genes within hours. Integration of mNGS into diagnostic algorithms shortens time to targeted therapy from a median 96H, standard culture, to 24H, reducing 30-day mortality from 22% to 15% in septic patients. Optimal management combines rapid sequencing results with guideline-directed antimicrobial regimens, dose adjustments for organ dysfunction, and multidisciplinary stewardship. Key points. Note: Metagenomic NGS, mNGS, demonstrates pooled sensitivity equals 85%, 95% CI7891%, and specificity equals 95%, 95% CI9298%, for bacterial meningitis, IDSA 2023. The average turnaround time for clinically actionable mNGS results is 24H, interquartile range equals 1830H, versus 96H for conventional culture, CDC 2022. In the United States, 1.7 million, 0.5% of all hospital admissions, sepsis episodes per year are amenable to mNGS-guided therapy, saving an estimated $4.2 billion annually. Health Economics 2023. A positive mNGS result for Staphylococcus aureus correlates with a 30-day mortality reduction from 28% to 12% when therapy is switched to vancomycin 25 mg per kilogram for loading dose than 15 mg per kilogram Q12H, target trough greater than or equal to 15 g/ml. The WHO recommends mNGS as a Tier 2 diagnostic for antimicrobial resistant AMR infections in low and middle-income countries, 2021. For pediatric meningitis, mNGS-directed therapy reduces hospital stay from 12 days to 7 days, p less than 0.001, NEJM 2022. Metagenomic sequencing detects viral pathogens in 42% of encephalitis cases previously labeled idiopathic, Lancet Infect Dis 2021. The cost per mNGS run is $1,500 plus or minus $200. Bundled reimbursement under CPT 81401 averages $1,800, CMS 2023. Empiric ceftriaxone 2G4Q24H for community-acquired meningitis achieves CSF sterilization in 96% of cases within 48H, IDSA 2023. Vancomycin dosing adjusted for CRCL less than 30 ml per minute to 15 mg per kilogram Q24H maintains therapeutic troughs while reducing nephrotoxicity from 18% to 7%. Kidney 2022. In immunocompromised hosts, mNGS identifies fungal DNA in 31% of febrile neutropenia episodes, prompting early liposomal amphotericin B 5 mg per kilogram for daily, IDSA 2024. The CURB65 score greater than or equal to 3 predicts ICU admission in 68% of pneumonia patients. mNGS adds a 12% incremental predictive value for atypical pathogens. JAMA 2023. Overview and epidemiology. Metagenomic next-generation sequencing, mNGS, is an unbiased, high-throughput technique that simultaneously sequences all nucleic acids, DNA and RNA, present in a clinical specimen, enabling identification of bacteria, viruses, fungi, and parasites without a priori hypotheses. The International Classification of Diseases, 10th Revision, ICD-10, Code Z13.89, Encounter for Screening for Other Specified Diseases and Disorders, is frequently used for billing when mNGS is ordered as a diagnostic screen for infection. Globally, the incidence of infections amenable to mNGS detection is rising. In 2022, the World Health Organization, WHO estimated 9.8 million cases of community-acquired bacterial meningitis, 2.1 million cases of invasive fungal infections, and 12.5 million cases of viral encephalitis. In the United States, 1.7 million sepsis admissions, 0.5% of all hospitalizations, and 150,000 cases of culture-negative pneumonia each year are potential candidates for mNGS, CDC 2022. Regional data show the highest utilization in North America, 42% of tertiary centers, Europe, 31%, and East Asia, 18%. Pathophysiology. mNGS leverages the principle that pathogenic nucleic acids are released into host fluids during infection. In bacterial meningitis, bacterial lysis releases chromosomal DNA that diffuses into cerebrospinal fluid, CSF. The concentration of bacterial DNA correlates with bacterial load, R equals 0.78, P less than 0.001. Host innate immune receptors such as toll-like receptor 2, TLR2, and TLR4 recognize pathogen-associated molecular patterns, PAMPs, triggering NF-kappa B activation and cytokine release, IL-6 median 112 pg/ml, TNF-alpha median 48 pg/ml. Genetic susceptibility influences pathogen detection. Polymorphisms in the TLR4 ASP299 GLY allele increase risk of gram-negative sepsis by 1.7-fold, GWAS 2021. In viral encephalitis, host expression of interferon-stimulated genes, ASGs, such as MX1 modulates viral replication. Higher MX1 expression, twofold baseline, reduces viral load by 45%, RNA-seq data. Clinical presentation. Infections diagnosed by mNGS present with a spectrum of symptoms that vary by pathogen class. For bacterial meningitis, the classic triad of fever, neck stiffness, and altered mental status occurs in 62% of adults, 78% of children, and 41% of elderly, greater than 70 years, patients, IDSA 2023. Headache is reported in 85% of cases, photophobia in 48%, and seizures in 22%, prospective cohort N equals 2,300. Viral encephalitis presents with fever, 92%, headache, 71%, and focal neurological deficits, 38%. mNGS identifies viral etiology in 42% of cases previously classified as idiopathic, with HSV1 accounting for 57% of detected viruses. Diagnosis. 1. Initial assessment, obtain blood cultures, CSF analysis, cell count, glucose, protein, gram stain, and basic labs, CBC, CMP, lactate. 2. Risk stratification, apply MSI or CURB65 for pneumonia to determine need for urgent empiric therapy. 3. Specimen selection for mNGS, preferred specimens, CSF, for meningitis/encephalitis, bronchoalveolar lavage, BAL, fluid, for pneumonia, plasma, for disseminated infection, and tissue biopsy, for deep-seated abscess. 4. Nucleic acid extraction, use validated kits, e.g., HuIAMP DNA/RNA mini kit, with input volume greater than or equal to 200 L. Extraction efficiency greater than or equal to 85% required for reliable detection. 5. Library preparation, perform ribosomal RNA depletion, ribo0, and random priming, target fragment size 200300 BP6. Sequencing, run on Illumina NovaSeq 6000, paired end 150 BP, achieving greater than or equal to 30 million reads per sample. 7. Bioinformatic analysis, human read subtraction, alignment to microbial reference database, and application of a read count threshold, greater than or equal to 10 unique reads. 8. Interpretation, correlate organism read count with clinical context, consider contamination if read count 5 an organism is a common skin flora. Condition, distinguishing feature, mNGS utility, bacterial meningitis, CSF neutrophils greater than 80%, detects pathogen DNA even after antibiotics, viral encephalitis. CSF lymphocytes greater than 80% identifies viral RNA/DNA, e.g., HSV1, autoimmune encephalitis, antibody panel positive, no pathogen, negative mNGS helps exclude infection. Tuberculous meningitis, CSF ADA greater than 10U/L, low glucose, mNGS detects Mycobacterium tuberculosis. DNA, sensitivity equals 71%, fungal pneumonia, serum galactomannan greater than 0.5 G/L, mNGS identifies Aspergillus spp. DNA, sensitivity equals 82%, key points, blood cultures, sensitivity equals 70%, pre-antibiotic, specificity equals 99%, IDSA 2023. CSF gram stain, sensitivity equals 60% for S. pneumoniae, 45% for N. meningi. Management and treatment. Key points: airway, breathing, circulation, ABC. References. 1. Hilt et al. Next Generation and Other Sequencing Technologies in Diagnostic Microbiology and Infectious Diseases. Genes. 2022, 13-9. PMID 361407333, https://pubmed.ncbi.nlm.nih.gov/361407333. DOI 10.3390/genes 130915666. 2. Diaz et al. Metagenomics next-generation sequencing tests take the stage in the diagnosis of lower respiratory tract infections. Journal of Advanced Research. 2022, 38:201-212. PMID 355724006, https://pubmed.ncbi.nlm.nih.gov/355724006. DOI 10.1016/J.Jar.2021.09.012. 3. Gutfreund MC et al. Metagenomic next-generation sequencing in pediatric infectious disease diagnosis, a comprehensive systematic literature review and meta-analysis. Diagnostic Microbiology and Infectious Disease. 2026, 114, 4117248. PMID 415000047, https://pubmed.ncbi.nlm.nih.gov/415000047. DOI 10.1016/J.Diagmicrobio.2025.117248. 4. Chen J. et al. The application status of sequencing technology in global respiratory infectious disease diagnosis. Infection. 2024, 52, 62169-2181. PMID 3915290, https://pubmed.ncbi.nlm.nih.gov/3915290. DOI 10.1007/S15010-024-02360-4. 5. Osei-Sekir J. Next Generation Sequencing in Infectious Disease Diagnostics, Economic, Regulatory, and Clinical Pathways to Adoption. Microbiology Open. 2025, 14, 6E70104. PMID 413059554, https://pubmed.ncbi.nlm.nih.gov/413059554. DOI 10.1002/Mo 3.70104. 6. Edward P. et al. Metagenomic next-generation sequencing for infectious disease diagnosis, a review of the literature with a focus on pediatrics. Journal of the Pediatric Infectious Diseases Society. 2021, 10, supplement _4S71S77. PMID 349514666, https://pubmed.ncbi.nlm.nih.gov/349514666. DOI 10.1093/TID/PAB104. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.